afternoon, everybody. Thank you for coming for this session, and I hope you will enjoy it. We'll try to do it as entertaining as we can. Before we start, Emily and myself would like to acknowledge that this presentation is being given from Treaty Number 1, which is the original land of the Anishinaabe, Cree, Ojibwe, Dakota, Dene people, and also the Métis Nation. So thank you very much for coming. A little bit of introductions about your presenters. Myself, I'm Victoria Grima. I'm an international student, a master's student at the University of Manitoba. I'm closing up my thesis right now, so very excited. I have an undergrad in architecture and civil engineering, and I also have a postgrad advanced diploma in GIS. And in my free time, I like to do some photography and go for walking. And I'm not sure if you can see my background, but I'm from the Mediterranean area. I'm from a very small island called Malta. So the background is one of the beaches that we have in my native country. So so that's myself. Emily, you want to say something about yourself?
Yeah, so I'm Emily. I'll be presenting with Victoria on our project here that we've been working on for the last, I guess, year now. Yeah, I'm an environment student, or I was an environment student in the Faculty of Environment at the U of M. And I am now the communications coordinator for the COVID-19 Indigenous project. Yeah, so that's a quick little intro about me.
So thank you, Emily. As Emily has been saying, so our presentation is about how we went through map information regarding COVID-19 cases in First Nation Indigenous communities across across Canada. So we're going to go through 6 points. And first, we are going to give you a brief of context on the data itself. Then we go to the content of the data, the analysis part of it, the challenges that we went through, and the spatial distribution, with some visualization there, the validation process, and then conclusion. We'll wrap it up about the next steps that we're currently going through. So, Amelie, you can
All right, I'll start us
through.
Okay, so a little bit about the project and why did we decide to map COVID-19 cases in Indigenous communities across Canada? Our organization, we've been around, I guess, we got funding last spring to start figuring out ways to best respond or to best help Indigenous communities respond to the COVID-19 pandemic. And so initially we started talking to a bunch of communities that we had relationships with in Manitoba, Saskatchewan, Alberta. And throughout these discussions, this was like early on in the pandemic in like March, April, a lot of the same themes kept coming up. One of the challenges that communities were having is that they identified that they didn't have access to race-based data. Which eventually some of the provinces, actually Manitoba was the first province to start recording race-based data. But First Nations that we were talking to said that this information would be super helpful for them to inform their emergency response decision-making. And by not having access to this, it was really not helpful for them. So initially, that's where this project came from. We thought it was vital to understand the spread of COVID and the disproportionate impacts as well. And obviously First Nations communities have the right to know what's happening in their communities. So this project has been really beneficial for a lot of communities. Also just before we get started, a disclaimer on the data. I'll talk a little bit about this later, but a lot of the data isn't fully accurate in the picture that you're gonna see here. I'll explain this later in the pros and cons, but just keep this in mind while viewing the data. there's just so many challenges with and barriers that make the data not as accurate as it doesn't necessarily draw an accurate picture as to what's happened in real life. So keep that in mind as we show the data, and we'll touch on that a little bit later as well. Yeah, and so the data we gathered was the total cases, the recovered cases, the total active cases, new cases, and passings. Yeah, so as I mentioned, the time period. So this was, I think we had data in March. Yeah, March 1st till December 31st is what this presentation will compromise of. So we collected 300 days of data over 2020. There were two main types of data that we gathered. There was microdata and there was macrodata. The microdata was the communities themselves, so data for the individual communities, and the macrodata was the total provincial data. And then where did we gather the data? We got it from a variety of sources. Indigenous Services Canada and health departments were helpful, but we also ended up reaching out through social media, news, and Facebook pages. Community Facebook pages were like the most accurate place to get data at a certain point as well.
So what about the data itself? So once we started gathering this numbers and information, we wanted to see it in much more in detail, and we wanted to do an analysis on it and see if there's anything coming out, if there was a trend or something specific. So by the end of the year, they published information that the Indigenous Service Canada stated that there were a bit around 8,500 cases by the end of 2020. And this map showcased the distribution of those cases between 7 provinces. And when we compared that provincial total with the numbers that we were gathering from the social media that Emily explained to you, we saw some discrepancies between numbers. As you can see, the SM means the social media data, and by the end of 2020, that particular database was providing us that there were around 5,977 cases. And we also noticed that the Indigenous Service Canada was not capturing the cases that they were being published for Nunavut. So this we were sort of seeing, that discrepancy and questioning the validity of our numbers that people, journalists and even health authorities were publishing on their websites and online. So we thought, okay, let's take it a bit further, and we went into the breakdown of the data itself on that micro level per community, and we cleaned it up, continue clean it up, and we noticed that this is the distribution of cases provincially. So Alberta in 2020, according to the data that has been published that we were gathering, had the highest number of cases, 2,195, and Manitoba came second with 1,647. If we go community-wise, we saw a change. Although Alberta had the highest cases, did not have the highest community that were experiencing the COVID virus. Saskatchewan was the province that had the highest communities being affected with this virus. In fact, according to the data, there were 36 communities. And with regarding to that, again, then it shifted to Alberta. There were around 32. So there's still an instability here, but at least we're seeing something and something concurring with the numbers. We also wanted to look about age, the age group. And this data was extracted from the Indigenous Service Canada. So that's where the data is coming from, because we couldn't find any other source that was publishing, provincially, this data. So for the male, we've seen that there was a trend picking up. So at the beginning of June, July, the age group for the male were between 40 and 59. The percentage was really high, and even for those between 20 and 39-year olds, so the percentage was still high at that beginning. Where at that time, June, July, cases in the urban centers were sort of calming down. And during the year, as you can see, the graphs here, the green and the yellow, stabilizes that a bit. But then we saw another trend here where the orange arrow is showing that there was the percentage of cases in those that are between 5 and 19 years old was picking up by the end of the year. So this sort of was showing a little bit, there was a shift in the age group that has been affected with the virus itself. For the female side, it's a little bit kind of different, and here we see that in June, the age group between 40 and 59, the percentage is still high, but not as high as the male, because it was 17%. But then it spiked really high up in July. Over 21% of the population, female population, was being affected. It started to stabilize a little bit throughout the year, but still it was still high. So it stayed between the 21% and 17%. For the age, if we compare for the age between 5 and 19 years in the female, there was a spike in September. And it seems like in conjunction with the second wave that we've been experiencing, the introduction basically of the second wave. So again, we tried to understand the data, the numbers, what the numbers are telling us. So we went also with the nations and see who is being affected the most, and the percentages were showing that the Cree population were being affected the most, have been affected the most last year with COVID-19. At almost 34% of cases were in the Cree communities, and then we have 9% with the Ojibwe and the Inuit 8%. And what is this in relation to the provinces? So here we did a graph per province to see that distribution. So Alberta, we have 7 Cree communities that have been affected, and obviously we did this for each province to understand the distribution of these nations and also in relation to the number of affected communities. So here in BC, we have the Dak and the Nukta. I'm very sorry about the pronunciation if I get it wrong. Then we're moving forward, we have Manitoba. Again, the Cree community here is the mostly affected, 9 communities. And we go forward to Nova Scotia, the Mi'kmaq. And then in Inuit, we have in Nunavut, we have the Inuit, and in Ontario, the Ojibwe, and we have 9 communities. And then in Quebec, we have again the Cree on the second place, but the Inuit and the 7 communities. And then lastly, Saskatchewan, we have the highest Cree communities affected here. So these numbers, show us a bit of a trend too. The biggest communities of Cree are in the prairies. So this is sort of goes into that trend that most of the prairies have been affected with these viruses. So again, would continue looking at the data itself, and we wanted to see if there's even a hotspots area. Again, we went through per province. We did this exercise per province, and we also, trying to understand, to read what constitutes the number that we were cataloging. So here is our Alberta, and these are the communities that we were able to identify that they had COVID cases. So this is the database cleaned out in Excel, and we have the reported deaths, the reported cases. We also included population to see if also there's a correlation somewhere there. Most of the population was extracted from the Statistics Canada. So unfortunately, as you are aware, that's not also the true number of population, because it's a percentage of the total. And the red ones that you're going to see also in the other slides are from 2019. And as Emily said earlier, this is a question that even us were questioning. It's been a long time that even Indigenous Services Canada and other Indigenous authority has published the true number of the population of the communities themselves. So for Alberta, the highest number occurred in the Makwasis Nation, and coming second, the Mackenzie County. So this is not only related to numbers here, but we also how this data was being published. So here you can see with this list, and you're going to see it with other provinces, various protocols and how this data was being published. So at first, at the beginning, we were noticing that journalists and other online news pages were publishing numbers related to community itself. But as we go along, that changed, and the numbers were being published in according to the nation. So if we look at the Makwasis Nation, it constitutes 4 communities. So the 519 cases, we really don't know where it's coming from at this stage, because it's a holistic a holistic number, doesn't reflect the community itself. Regarding what you're looking further down in the table, like the county, is the same thing. Then after, in the middle of the year, we even geographically, the data, even government and provincial, were being published as a municipality level and a county level. So in reality, we don't know the names of those communities that have been affected. So this is sort of another concern for us, which Emily will also discuss further, where we talk about these challenges. So if we go forward, so we did the same process, as you can see with BC. We have the highest at Albert Bay and the Haida, and we did again for Manitoba. We've got the Shamantawa First Nation, which was at its peak at the end of the year, and Nova Scotia, Nunavut, we've got Arviat, and Ontario, Six Nations of Grand River. So this is, again, this is a group of nations. So then again in Quebec we have Mohawk, and then this is Saskatchewan. We've got Big River and Lakota. Spatially, obviously we wanted to see this spatially, and these are the communities, all the 138 communities that we were able to track down, and we mapped them out. So you can see the numbers relate with geographically, because there's quite a concentration in the prairie provinces. Manitoba, Saskatchewan, and Alberta were those highest percentage of Cree communities being affected. But also from this, we were noticing a shift a bit northwards, and the this shift is mainly in those communities that are remoted, and they are not, connected with at any highway. So this was sort of a concern, and we wanted to see why this is happening and check it out. But we'll talk about it later on a little bit, because this is part of the validation process. For the challenges, Emily will get us through these.
Yeah, so there's a lot of pros and cons. I guess more so we could call them positives and challenges. So yeah, some of the positives that came out of what we did. So yeah, it was really helpful for ourselves and for other people to be able to see a geographical visualization of the active cases. That can really be useful for viewing trends and waves, which the trends and waves in First Nations communities across Canada have been fairly similar or fairly in line with the Canadian or global trends, but not completely. So that's been really interesting to be able to see that data in a comparison. This was also the first attempt to log data at a micro level that we have found. We haven't found, at least we haven't, found any other attempts to log such like micro data. So like at the community level, the ethnicity level. So taking the different ethnicities of the Indigenous communities across Canada, as well as per province. And it was also just really helpful because this information is able to inform decision making. So those are some of the pros of this project and some of the good things that have come out of it. But as you can see, the cons or challenges is a lot larger. We faced a lot of roadblocks trying to log this data. Has been really time consuming. The published numbers are constantly changing and being updated or amended. So sometimes you'll go on to Indigenous Services Canada, and that data will be updated 2 weeks later again from something that you looked at in, I don't know, August 2020. Like that's still happening right now, which is really challenging to ensure that the data is accurate. And so it's like you need to be constantly checking that data. Data from various sources as well. As I mentioned before, there was a lot of different sources that we're using to gather this data. There's also a lack of data from credible sources. Community Facebook pages ended up being the most accurate way for us to track information and most up to date. However, due to a lot of, I guess, instances of racism in a lot of communities that are nearby or like towns nearby to Indigenous communities, a lot of these community pages have gone private to protect the community and to not advertise the number of cases, which absolutely makes sense. So that was one of the barriers that we faced as well. Reporting tools will also vary by province, and race-based data was being gathered by Manitoba, but it isn't being reported on. Some of the other provinces are also gathering race-based data, again, not reporting on it. So that was really, really difficult as well. There's also an inconsistency of data. For example, the federal government and Indigenous Services Canada, they're both run by the federal government. Data from one source is different from the other source, and you'd hope that those are credible sources. And however, they were not accurate and they didn't line up. There's also data backlogs. Data wasn't being published on the weekend in Indigenous Services Canada, and as I mentioned before, previously published numbers have been and are still going back and being edited, so it's really hard to keep track of. The representation of the numbers published. So because there was so many different reporting tools being used, we had a really hard time figuring out, well, if Indigenous Services Canada says there's 10 cases in Shimanoa First Nation, CBC News says there's 12, and their Facebook page says there's 2. What's the most accurate? So by using different reporting tools, it was really difficult to decide what was the most accurate source and to get a full picture of what was going on. There's also no on and off reserve differentiation in most of these numbers. Some communities eventually did do this, but most haven't. So it really doesn't give you a full sense of what's happening. As well, a nation is sometimes a representative of a number of communities. So, for example, in Manitoba, Island Lakes represents 4 communities. And so, by reporting cases under Island Lakes, we weren't able to get an accurate representation for those individual communities. Yeah, so the other thing was clear jurisdiction. Sorry. I almost missed that one. Yeah, so some communities cross provincial borders as well. And it wasn't clear where those cases were being reported. Are they being reported in Saskatchewan or Alberta or Quebec or Nunavut? We don't know, and we weren't able to get an answer on that. And so that also would impact the data and the numbers being reported. So all of that taken into account, we still went ahead and continued to use the data that we had gathered. And the next step was to validate the data that we do have to make that data as accurate as we can make it.
Yeah, before we go into the validation process, I noticed some questions in the chat room. Just to let you know, we will once we finish the presentation, we will have time for question, and we'll answer your questions at that time. So yeah, so as Amelie said, when we presented this information to the main researchers, and we were showcasing how difficult it was for us and challenging, especially to really quantify the reality of what represents the number that we were cataloging. And also, at one point in time, although we started with the premise that we wanted to map out spatially this information, as the year concluded, we found that it was sort of not impossible, but it was challenging in view of these different protocols in order to map out this data really accurately. So after we discussed with the main researchers, we started the validation process. And the validation process, as we all know, is from a number that we are questioning what it represents to make it credible. So again, we started. It's quite a long process. We're still in it, and because every day some things change, and so we started with the micro level. So the Indigenous Service Canada has the mandate to take care all Indigenous communities, Métis, Inuit, Cree, Ojibwe, Anishinaabe. So that's all, Algo and Inuit goes under its mandate. So, okay, so we have all those totals, and we went into the data, and obviously there were duplicates. And the duplicates data are quite high, especially for April and August. And this was because we noticed that Indigenous Service Canada was late in updating their data, and sometimes they take 2 to 4 days. So that's a big gap in when you gather this type of data. So okay, we said, all right, so what about the Indigenous, the community level? And we took at the epidemiology summary of the First Nation communities, that the sources that Indigenous Service Canada takes in consideration to publish their numbers, because we thought, okay, let's start from those. And these are the main sources that Indigenous Service Canada gathers information. And we noticed that Alberta First Nation Information Governance Center, the last update that occurred was in 15 July 2020. They reported their first case on that particular website on the 17th March 2020. According to the Indigenous Service Canada, the first case reported in Alberta was in a bit for them the week of March 19 and April 4th. So again, we're seeing discrepancies again. And British Columbia First Nation, the last update was 14th June 2020, but they never published any, we never noticed any published data regarding communities themselves. The Chiefs of Ontario website extracts information from Indigenous Service Canada, so we couldn't get that information. And then we have Manitoba First Nation Health and Social Secretariat. And here in Manitoba, they establish a task force, and they're doing quite a good job. Although the data is still sporadic, but they're doing sometimes daily reports, weekly reports, and even Zoom meetings to inform about what's going on. Again, and here again, we saw a discrepancy. According to their reports, the first case reported in Manitoba was 15 May. But for the Indigenous Service Canada, the first case was reported in the week of September 13 and September 19. So you ask yourself, so where should we find this true data? So as Emily explained, yes, for the macro level, we had to go to Facebook, and we went to the community Facebook pages, which some of them are public and some of them are private. So where we could find those pages public, we were noticing that the communities were sort of publishing this type of card. They're producing the information, the new cases per day, the total active recovered, and also the total cases. But however, we saw also discrepancies in this data. So while we focus, we noticed that the new case per daily was accurate enough for us to have a good true account of what's going on in the community. So we did this exercise for we started it. We started it for each provinces, and I'm going to give you an example just for Manitoba what we did. So we have we cleaned it up the original. So we started initially. We identified 19 communities, and we cleaned them up for each. So we created this sort of sheet and sequentially by day, and new cases by day and confirmed cases. So the confirmed cases, we created a formula so that we can have an accurate number of cumulative numbers. From that, so yes, so we did that exercise for Manitoba. As I said, initially we gathered 19 cases, 19 communities, but through the validation process, we were able to identify 21 communities. So the gray area are the communities that we couldn't yet validate in view either their Facebook page is public or we couldn't find a reliable source. And the yellow ones are the ones that we were able to validate. So the new extra communities that we saw were the Norway House and Buniboni Cree Nations. And as you can see on your right-hand side last column, those are the validated numbers. So there's quite a gap and quite high numbers from the true from those that were published and from online reports. So once we did this, there's the researchers were discussing, and we were curious how this can be visualized, this data. So we're going to show you a quick animation for just Manitoba, so that this is another way to understand that. Hopefully it should fire up. Oh, there we go. So what you're going to see you're going to see the numbers per day increasing, and even this circle increases as those cases increase, and also the communities pop up. So this is another way to showcase this information not only to our researchers but also the communities that we're working with, to see how this it's spread through time and how those numbers grew through time. So this is another visual tool that we're we're going to present further on, to our communities, and give them as a tool that to understand this particular data. So going into the last part of it, Emily?
Yeah, so next step, so we're still validating some of the data and continuing this process. Yeah, and I think a lot of the data we have had a lot of challenges with gathering a lot of data, as I mentioned, and so for the time being, we're just validating the data that we do have from 2020, and we're not gathering as much new information at this time, just due to the fact that there's been a lack of publishing in data and a lot of the barriers that we've been facing. So we're still collecting data slowly, but we thought it would be more important for us to just go back and look at 2020 and continue to validate that data that we have. Yeah, and then we're going to take the validation one step further now. So this is what we're currently working on by doing a distance analysis of the data that we have collected.
Yeah, so this sort of came out from the geographical visualization of the spread itself. And since we were noticing, as you recall, Ariel, I said we were sort of seeing a shift going north. So we were sort of curious to see about the distance analysis. We're discussing about this analysis, identify those communities who are remote, who are connected with a highway or just flying, and identify the urban centers that they have hospitals and clinics, and see the distance in order, and this will be helpful to understand those rapid response situations, especially we are aware those remote communities, especially northern, that they are fly-in. It's very difficult for them to have access to healthcare. So this is the last part of it. So this research is evolved from the beginning, and it evolved through, the goal was to map it out, but as the data was being published, the data was sort of the type of publishing was dictating the process of who were taking it. So we took that steps into understanding the numbers, cleaning it out and understand if they are true or not, and and continue evolving and understanding, and which trigger the validation process, and which, as Emily stated, is still ongoing, because what we have 138 communities to go through and takes time. And as an example, we saw in Manitoba, we added two more, and then obviously we have to do the distance analysis. So yeah, Emily, do you want to open up for questions?
Yeah, I think so. I think I saw two questions in the chat actually, that I can start with. But if anyone else has any questions, also feel free to like raise your hand and speak out loud as well. The first one is from Erica. Erica says, "Other than in this great presentation, how is this information being shared?" Yeah, so we have the information up on our website. That being said, we don't. I guess that makes me think that we should probably share something like this PowerPoint and stuff, but without an explanation, it probably wouldn't be that useful for a lot of people.
We're thinking to publish the information once everything is finalized, and obviously we accommodate the researchers' request, and we see, that if we can do furthermore, we aim to publish this information. As Emily said, we on the website we try to keep up updates as updated as much as possible. And as I said, we had a map at the early stages of these communities, but then we sort of we saw that in view of those challenges that we were experiencing, we didn't see the feasibility of it. So we have graphs, and we created like a doodle, like a graphic to showcase the numbers at least, and total numbers.
Mm-hmm. Okay. Other question was from Jerry. Awesome presentation. Thank you. Is it possible to get data from health facilities involved in testing COVID-19? The short answer is no.
Yeah, we saw, some, not all provinces are providing data regarding the testing, even the vaccine, how many people are getting the vaccine. So there's a consistency through all provinces themselves. The Indigenous Service Canada is changing how it's reporting. To this week they added now how many vaccines are being given. So, but we don't know how to again the number, if it's true, it's backing the reality, because we know that Indigenous Service Canada are slow in publishing and updating their database themselves. So that's a challenge also. What I can say is from the exercise and of what we've been doing is, if we go into the community itself, uh, they are right now, they are providing a number of vaccines, a number of vaccinated people in the community, and that number seems much more accurate than what the federal and the provincial government are publishing. But it's a difficult task to gather that data, because not every community publishes that information. And some community are not even publishing how many COVID cases there are in their community, and it's understandable, because you don't want to alarm people, you don't want panic, so you want to contain it as much as possible.
Yeah, there's also a lot of like healthcare data is sensitive information, and so I think a large part of the challenge with publishing that data also is like, yeah, it is sensitive information, and um, it's it's private information for people as well, right? So yeah, I think it's I'm surprised. It's awesome to see that we are able to see some of this information on like Facebook pages and by talking to people and stuff, but it's yeah, it's not an easy task. And health facilities really aren't able to give out that data. Even though we are doing this project, they can't just provide us data and information. It's not as simple as that, and I wish it was, but there's so much privacy and laws around sharing of data with healthcare, especially. So
Yeah, for ours, what we can say from our experience, this is the first time that Emily and myself are dealing with health data. I personally am quite experienced in various other databases regarding GIS analysis, but regarding in health data, it was both of us, was the first time that we were really dealing with it, and even dealing how news is published on the web. And we were sort of surprised how even this, for example, let's say you have CPC journalists, and you have 5 journalists reporting on COVID cases, and even between those journalists, they were reporting it differently. So that's in itself, it's quite challenging to understand where the numbers coming from, and which community relates. So yeah, it's what for us it was quite a learning experience, really, and we're still learning it, and we're still really understanding the numbers themselves. So yeah, in the end, we we will share this information with communities so that even themselves, they have um, they can understand what they're doing, what they need to be done, especially health-wise, and if we can help them out improve any systems. But this shows really, as we were talking about, how this sort of COVID-19 issue reporting numbers is all over the place, really, and it took quite a long time for us to
Yeah.
understand it.
Yeah, I think it also just speaks to like how institutionalized healthcare is, and the need for First Nations and Indigenous communities to have a little bit more control over healthcare. One
Hmm.
of the challenges that that is still existing is, yeah, like these communities often aren't able to have the first pieces of information at the beginning of the pandemic. A lot of communities were finding out about numbers in their community,
Hmm.
not from their community leadership, but from news sources, which isn't not ideal. Yeah, so I think that speaks a lot to just this project really speaks a lot to like a lot of the challenges with how institutionalized healthcare is, and yeah, the need for First Nations to have more control and sovereignty
Yeah.
over their health for sure.
And I think a good example of what Emily is saying is the data that we were looking from, gathering from the Indigenous Service Canada. Everybody knows it's a federal authority and has jurisdiction on to take care of all Indigenous community across Canada. But we were seeing that, for example, none of it numbers were not being published at all, really, and they started provincially, and then or even for the East Coast, all of a sudden they gathering it under the Atlantic. So that's a discrepancy too. So either you start, publishing data at provincial level, or you're just publishing at jurisdiction level, and that's gets a discrepancy there. I believe Francesca has a question.
Hi, yeah. I was just wondering, kind of speaking with your experiences about the discrepancies and difficulty finding um, information where there isn't any. Can you comment on what you think ideally would be best moving forward to get numbers for other issues and other cases like that? Like, would you want it to be centralized or decentralized, and from what, I guess, services or resources would you prefer that to be?
Well, I think there should be a protocol that everybody, you know, goes through. Same protocol across Canada, because each province is publishing data as they want to, and they're not establishing as the same protocol for even the federal government. So this at the beginning, the federal government should have established protocols for all provinces and to take care that the numbers are true and correct. We understand that the resources are limited, and we understand that there's a backlog. But to have a backlog of a week, or even say, during the weekend we're not going to publish data, it's a little bit, when you have a pandemic, which everybody is worried about, and the spread is, it's intense, and now it's growing. Those numbers, they have to be published every day so that people are aware, conscious of what they're doing and where they're going. So protocols are quite important, same protocols, not only for the authorities, but also for the journalists, and, also respectful. We need to be respectful of everybody. It's, this is something that affected everybody, and we should be respectful of the numbers of the communities being affected, and how we project these numbers. Emily, do you want to say something on this?
No, I think I agree. Yeah, it's tricky. I think it sucks to put in more policies because sometimes it creates barriers. But I think, yeah, there should be some sort of protocol that is like informed by these communities, or that they're at least involved in, so that they can have access to this information first. Yeah, I don't really have much else to say other than that. But I think the communities would also have a lot to say on this as well, who are experiencing it firsthand. Yeah.
And to showcase that there's more to be done in the healthcare system, especially how we publish data in the healthcare system. There's a lot to be done, and this pandemic shows how sporadic the data is and unreliable is, and showcase how we need reliable data, especially when we have a pandemic that is happening. It started in taking our elders, and then there's a shift, and now we have a shift in the younger generation. So it showcased that we really need good data so that we have to do informed decisions, and even the communities have informed decision to do about their healthcare system.
Great, thank you.
Are there any other questions? I think we're almost at 3 o'clock here, but we've got some time if there is. Oh.
Should we do you want to we give our email addresses just in case?
Yeah, definitely. I think if there are questions, I'll put mine in the chat here. But if you guys do have questions at a later date or want more information, yeah, we'll both put our emails in the chat here. And yeah, and feel free to reach out to either myself or Victoria if you do have some questions. Yeah.
Yeah, we're very happy to answer any questions that you have later on, or if you any more clarifications. Thank you so much for attending this session, and I hope that it was informative and provided a little bit, not a clear picture, but the challenges of working with this type of data. Thank you very much.
Thank you, everyone.
Have a good afternoon and evening.
Thanks, everyone.
Thank you. See you.